Hello everyone. Now we are going to see about the general antenatal checkup. So this is mostly the antenatal checkup that is done in states. So without further delay, let's go. What do we generally do? So we will check for the mother's blood grouping typing. So why do we check for mother's blood grouping typing? Because if the mother is whether to determine her RH status, whether she is A positive or A negative or B positive, that is whether she is positive or negative. What does this positive or negative indicate? It indicates the RH status. So that is, if she is positive, then it means she is RH positive. If she is negative, then it means it is RH negative. So what are you going to do knowing this? If she is RH negative, then what does it mean? It means that she doesn't have that RH antigen in her body. That's why she is negative. But when the child or the baby has, or the neonate which is present in the mother's womb is RH positive, that is she has that antigen, then the antigen can pass placentally to the mother's blood circulation and the mother can produce antibodies against it, thereby destroying the antigen, those which are present on the neonate's RBCs. In this way, when those RBCs are destroyed, the neonate will suffer from hemolysis and it can progress on to erythroblastosis fetalis too. So since we don't want any of this to happen, that is, we don't want the RH negative mother to get sensitized with the RH positive antigen of the fetus, we check for her RH status. Now, if she is RH negative, the mother is RH negative and the baby is RH positive. So we give them antibodies to neutralize. So what are the antibodies? That is the RhoGAM. This RhoGAM antibody will neutralize the RH antigen which has entered in the mother circulation. So that is the role of it. So when do we give RhoGAM antibody? The RhoGAM is given at 28 weeks. So why do we give at 28 weeks? This is because the studies have shown that it will result in some amount of minor bleeding within the womb. So therefore that can trigger the sensitization in the mother. So therefore it is given at 28 weeks of gestation. Secondly, if there is any other condition, like say if there is an abortion or if there is an abruptio placenta, in all these conditions there can be sensitization of this antigen in the mother circulation can happen. Therefore RhoGAM should be given. But on the other hand, the mother has been sensitized to the antigen in her first pregnancy. Now she comes for the second pregnancy where the antibody titer in the mother against the RH antigen is really high. In that case, will we be giving them a RhoGAM? No. RhoGAM need not be given because its use is limited. If the antibody titer is extremely high, then RhoGAM need not be given. So this is about the increased antibody titer. Then we do the regular blood tests. Thirdly, we will be checking for the BP, whether her BP is under control or should we do anything up to it. And we will be checking for her diabetes mellitus, glucose status too. But will we check the glucose status to all pregnant women? No, we don't. Unless they have the family history of diabetes mellitus. Say the mother is a diabetic or the father is a diabetic or any other family history is diabetic, then we will be checking for the diabetic mellitus. Otherwise, if she herself had gestational diabetes in her previous pregnancy, then we will be checking for her diabetic status. After that, we will do urine analysis where we will be looking for any bacteria, because the mother may not be presenting with any symptoms. She may not have any complaints of urinary tract infection like irritation or urgency. No complaints will be there. But still, even though she doesn't have any complaints, asymptomatic bacteriuria should be treated in a pregnant women, because I will tell you in detail about it, but as of now know that asymptomatic bacteriuria should be treated in the pregnant women. Therefore in urine we will be checking for bacteria, we will be checking if there are any WBCs, we will be looking for any proteins to look for any, to assess the kidney function. The kidney function test can also be done. We also need to screen if she is suffering from any sexually transmitted disease like gonorrhea, chlamydia, and we also check for pap smear to look for cervical cancer. In addition to it, we will be looking at hepatitis B, HIV, syphilis as well as rubella. Ultrasound should also be done where we will be assessing the crown rump length to determine the gestational age. flu shot should be given in a pregnant woman, and what flu shot should be given? Should the killed vaccine be given or the live vaccine be given? The killed vaccine should be given, which is given intramuscularly. Live vaccine is given intranasally. That should not be administered to the pregnant female because she is already in a state of immunocompromised. So live vaccine will do more harm than good. Therefore, killed intramuscular vaccine is administered. So these are the most salient points which are generally done in general antenatal checkup. Thank you for listening all this while.